Thank you, Tracy. We will now call the January 15th, 2021 Board of Health to order. For the record, if each board member, as I call your name, if you could just say whether you're, well, let's just do this. Is there, we'll just do kind of a roll call here. So Scott Fadness, present, board member. Any other board members present, please just state your name and that you're present.
Kyle Holtgren's present.
Karen Collins present.
Steve LaRussa present.
And Sam McGleroy present.
Okay. With that, thank you all for jumping on virtually today. We do appreciate that. I have to tell you, having been around City Hall the last week, our public health team has been running around fast and furious, as always, trying to meet the needs of our community. And today, I think on the agenda, we have kind of an overview. But before we get to that point, I would ask for a motion to approve the consent agenda, which consists of our meeting minutes. Is there a motion to approve?
Motion, Steve LaRussa.
Motion by Chief. Is there a second?
Second, Kyle Holtzman.
Second by Kyle. All in favor, please say aye. Aye.
Aye.
Aye.
Aye.
Motion passes unanimously. Thank you. With that, I'm now going to turn it over to our health department. And I assume we're going to start with Monica for basically an update on the status of the health department and all the things going on. Monica?
Yeah, hi everybody, this is Monica. I'm going to actually pass it over to Joshua Robinson, our epidemiologist, to give the update on all the stats.
Great. Hi everybody, this is Josh Robinson. I'll share the PowerPoint here. Just give me one moment. So today we'll be going over an overview of where we're at, and then can answer any questions at the end of this. And like I said, I'm Josh Robinson, epidemiologist. Monica Heltz is here, our public health director. Go through our previous and current orders, a review of COVID-19 vaccinations, our individual Fishers data, some projections across the US, Indiana, Fishers, and then briefly touch on our communicable diseases and other areas of work and what we have in the works for the first quarter. So our recent public health COVID actions, we had a continuation of Public Health Order 6 and our face covering mandates last week through Public Health Order 9. Additionally, we experienced for all of Hamilton County, Hamilton County went into red per the state assessment, triggering the governor's executive order 2048 for the county. Essentially, it puts in place further restrictions for counties that are in red, but our Public Health Order 9, the continuation of Order 6, meets or is a bit more restrictive in some areas than that. Additionally, since we last met, we had Public Health Order 8 that wasn't extended, but it went through the period of December 25th through January 8th, and it was closure of indoor dining and drink services from 10 p.m. through 5 a.m. over the holiday period. So briefly to touch on the state COVID updates, on the left you see the color-coded categories for all the counties in Indiana. There's a county level risk color coding scheme that has 4 advisory levels and color codes: blue, yellow, orange, red being the most severe. It's based on the number of cases per 100,000 residents and the all test positivity rate. To get into red, you have to have 200 or greater weekly new cases per 100,000 residents and an all test positivity rate that's 15% or higher. And Hamilton County exceeds that. They went to red last week. You can see on the map here that's the majority of the counties are in red. There are 19 that are currently in orange. This update, the state updates the counties each Wednesday. You have to be in a less restrictive color category for 2 weeks, 2 consecutive weeks before your county will be moved down to the less restrictive category by the state. So touch on our COVID vaccine. We're rapidly expanding this out now. The state recently changed their eligibility criteria to 70 plus. We have released a vaccine registry where anybody can register online, and as of opening of business this morning, we had over 17,000 unique individuals that have registered. We also have individuals on a standby list for when vials are opened and if there's any remaining at the end of the day for a variety of reasons. These are individuals that have indicated that they could be able to get quickly to a vaccination site, and there have been 13,261 individuals that have indicated that on their vaccine registration. In terms of our vaccinations for fishers, they're currently underway. As of the end of yesterday, they completed 80. They're increasing that to over 200 by tomorrow, with the goal of increasing the daily doses each day moving forward. Our appointment slots fill up quite quickly, so we're working to build out additional capacity for appointments and to release a dashboard that's currently under development that we rolled out relatively soon. It'll track the administration and relevant demographics of those to which we administer vaccines. So since we last met in the second week of December, that was on the 11th, I believe, at the time there were 5,455 positive COVID cases over time among fishery residents, 46 deaths with a case incidence rate, which is a 14-day rolling average of 96.86. Since we've met in the month and 4 days, we now know of 8,493 total positive cases, so that's 3,000 new. We've had 17 new reported deaths and a case incidence rate as of today at 100.45. That isn't our highest case incidence rate. We had several in the hundreds in December. In terms of thinking about just the absolute case numbers, December cases are pretty stable. Occasionally, the state will identify cases and backfill them with the relevant date, but I haven't seen the December cases change in over a week of reporting. There were 2,820 total cases in December, which is 17% more during the first 8 months, March through October. So our confirmed and probable COVID-19 cases since March is just graphed out here. We need to treat the reporting that we get from the state with a bit of a preliminary period. So as of today, I could look back with a decent level of confidence and compare the first through the 8th of January to the 1st through the 8th of December. And during that time period, we've seen roughly a 15% decline in the number of cases. Our infection growth rate is still above 1, so it's still climbing. Cases are still increasing. Moving on to COVID projections. When we met last month, this shows you COVID deaths across the U.S. from the Institute of Health Metrics and Evaluation. It's one of the more pervasive models you'll hear discussed out in the media and by other academics. And at the time that we met, they projected 538,000 deaths across the U.S. by April 1st of this year. Given the continued rise in cases and a variety of other reasons, they've since adjusted their model, and as of yesterday, they increased the projected number of deaths by 28,000 to 567,000 by April 1st. Here you see what the CDC puts out. They review different models for COVID projections from a variety of groups. On the left-hand side, you see all of the individual models by the group that creates those. And on the right-hand side is the CDC's ensemble model. We talked about this a bit last time. Previous research has shown that the CDC's ensemble model is a bit more accurate than any one of the individual models that is included in the ensemble. So on the right-hand side, top right, you see new weekly death projections for Indiana, with it starting to show a decrease in the weekly deaths towards the end of this month, entering into February. On the bottom right is the cumulative total deaths over time, and you can see in Indiana they're projecting towards the beginning of February to have over roughly around 11,000 total deaths. So we've been working on doing some modeling of our own for Fisher's projections, and I adjust this weekly once our reported cases, once the data settles and we can be more confident that new cases won't be added. And based on this model, it primarily uses a simple ratio, and it calculates infection growth rates. And it's, as I adjust it when the data comes in, it tends to be more accurate over time. And so we see cases continue to increase throughout Fishers through the end of March. So how are we faring? We look at how Fishers and our cases and a number of other metrics compare to Hamilton County. In Indiana, in this table here shows you 7-day ending metrics. So in the white, that's the metric, for example, the new COVID cases 7 days ending on the 5th of January compared to the next column over the 7 days ending on the 29th of December. So that 7-day period and on the 5th of January, we saw a 15% increase in new COVID cases, Hamilton County 13%, Indiana 20%. Uniquely, our individual positivity rate and our all-test positivity rate in Fishers decreased, whereas Hamilton County and Indiana experienced increases in those two rates. So we've been discussing a lot internally and for quite a number of time on considering what the sources of transmission in Fishers can be. This is admittedly difficult, not just for us, but for a lot of people, a lot of groups, to get hard data on the exact transmission. But we have some soft data points that give us some indications that at least can help guide us through decision periods. So on the right-hand side, top right, this is a community mobility breakdown. This is something that Google, in collaboration with Harvard, has been putting out for quite a number of months. And essentially, most of the mobile cell phone providers have released their data, anonymized mobility data from cell phones. And they are able to break this down into the county level for all 50 states. And so this shows Hamilton County. We can't get any more granular from the data there, but this shows movement compared to pre-pandemic movement over time for Hamilton County residents. The orange that you see that spikes up really high, that's parks. The brown line that's directly in the middle near the zero value, that's groceries, pharmacies. The green line is retail and recreation, so that would include any type of restaurants, bars, also events, venues, and stuff of that nature. And then the yellow is workplaces. So you can see a bit in the beginning around April and May. It may be hard if this is too small on your screen, but I will share the slides with you afterwards. You can see in April and May that mobility decreased across groceries, pharmacies, retail, recreation, and workplaces. And workplaces have had a steady decrease in mobility in Hamilton County amongst individuals over time. Whereas retail and recreation and grocery and pharmacies, you see that those numbers, and again, it's a bit difficult to see with this small of an image, but over time they tend to be at or below zero, meaning that on any specific day, if they're -5, then it's 5% less mobility at those locations compared to the same dates before the pandemic. And what we're noticing is that, at least in Hamilton County, that in certain categories, mobility in the community is remaining near the same. So grocery, pharmacy, retail, and recreation category, those two categories, that mobility is slightly reduced, but remaining the same. And so it's a reminder that everybody needs to exercise continued vigilance for the protection of their self and others when they're out achieving their activities of daily living. We do have from our contact tracing team in the health department some limited self-reported exposure data. And you can see the largest two categories where individuals believe that they were exposed to somebody with COVID and then contracted it. The first category, this large blue one here, is in a home or residential setting. And then the next highest category is social gatherings. And so this gives us some indication. It's from 11,172 known cases out of our 8,400. But it gives some indication that individuals believe they were exposed in those two settings or during that type of activity. And it indicates that spread in private and residential settings may be due to potentially relaxed safety precautions. So on to our communicable disease update. This is from our data that we get from the state and that we have to report as well. You can see the condition on the left-hand side of the table, the number of events that we've had, and this is since we've been established as a health department, and then just what percent it represents of all events. This was as of yesterday, so the COVID-19 number at 8413 doesn't reflect the cases that we had reported today. But you can see that the next to that, the next largest reportable event is animal bites, and then chicken pox down at the very bottom, followed by campylobacteriosis. In terms of our active permits, inspections, and vital records, these is a request for permits, vital records, complaints as of yesterday. So we have 4 birth certificate requests, 6 active COVID complaints, and you can see this going down the list for death certificate requests, food truck permits, for example, food establishment permits. So the inspectors are currently working on going out to any business that is not applied, and we'll start additional inspections in February. Where we want to go with Q1 or first quarter goals of 2021 that are in addition to clearly all of the priority we're giving to COVID and vaccinations. In addition to that, we plan to release our first annual reports that will look back at our first year as a health department, and then start the steps for a community health assessment and health improvement plan so that our actions moving forward in our second year are tailored to improve the health of our community. We are working, Monica and I, on applying to become a CDC Public Health Associate Program host site. We will submit our application on or before February 16th. If we are approved, then we will host the CDC PHAP individuals for a two-year training programs. And these programs target early career public health professionals that will work on specialized and defined areas to gain experience and then be better prepared to become leaders in public health. And we are also working on our health department development plan, so where we want to be in the next 1, 2, 3 years, our medium term and our long term goals, and we will present that to the board before the end of the first quarter. Sorry, and then our next meeting dates have been set. Our next one is February 12th. We'll be able to update you with a lot more information on our vaccinations, what we may need to address if COVID continues to stay at such high absolute new cases. And then the 2021 meeting dates are listed below, but you should be aware of these. Excellent. So I'm going to exit out of the PowerPoint, stop sharing my screen, and then take any questions that either myself or Monica will address. And I should apologize that I cannot figure out how to get my monitor camera to work, so you can't see my smiling face, but I am smiling and very happy to be here.
Thank you, Josh. Very much appreciate it. That's a very thorough review. And I know we'll probably look to Monica for more of an operational update here in a minute about kind of the logistics that she's dealing with these days. But are there any questions from the board in regard to a pretty thorough review of where we stand with this pandemic, as well as just kind of our overall communicable diseases? Are there any questions for Josh at this time from the board? Well, thank you, Josh. Obviously, it's pretty unique for us to have this level of sophistication in data and metrics and projections at a community level. That's pretty exciting. So we appreciate that. Monica, I know we've been very busy on the logistical front, and maybe just from an operational standpoint as a director, maybe you could share kind of your thoughts about where we stand today from an operations standpoint.
So our focus today, and I just wanted to mention that Dr. Indy Lane is on the call as well. So she is here and can answer questions as well. As far as operationally, our focus right now, I think it's probably pretty clear from what you guys have been hearing in the media, but it's very heavy on vaccination rollout and ramping up those plans as quickly as humanly possible. We've received our first doses of vaccine, and we have begun administering that vaccine, and we are actively pushing to get as much vaccine as possible to be able to get those shots into arms as fast as possible. I know there's been a pretty heavy backlog through the state on appointments since they opened it up to 70 and older. A lot of those individuals aren't able to find appointments, and I can explain the reasons for that, but those will come. There are more appointments coming. But in the meantime, we're heavily focused on, like I said, getting just as many vaccines as possible into as many arms as possible, as fast as possible. Otherwise, operationally, all of the rest of the activities of the health department continue. We continue doing a lot of contact tracing. I think we have about 20 people doing active contact tracing every single day of the week. We continue being able to notify people within 24 hours that they and do their contact tracing. We have a lot of success with the folks that are coming through our testing site. We continue to test over 600 people per day on most days between our two different sites and two different links. So operationally, it just keeps layering on top of. So in addition to that, we've started a new year. Everybody needs new permits. We've got new, so we're starting back over on our restaurant inspections, and our pool inspections. Everybody needs new permits, so we're rolling all of those over. And then on top of that, every single department is affected, because on top of that, the vital records, the state changed the system for the new year and it doesn't work. So we're dealing with a lot of those headaches and working with those funeral homes and other folks needing their vital records as well. So a lot going on every front, but right now the largest amount of attention is going to vaccines.
So I know that Dr. Lane has been providing oxygen to Monica to keep her up and running, but Monica, can you, because there's so much media focus, can you talk a little bit about the mass vaccination site and also the standby program, just so the board is up to speed on what those two components are?
Yeah, so we knew going into this that, as soon as the information started coming out about the vaccine that we were going to get, then we were able to kind of study that information. And so we knew going into this that we were going to have 10 doses in a vial. They're 10-dose vials for the Moderna vaccine, which is what we have. So that means that we have to use, at the end of the day, when we're vaccinating, we have to end on a factor of 10, basically, in order to not let any vaccine go to waste. The appointments don't always end on a factor of 10, so we want to make sure that each and every dose gets used. So we wanted to make sure we had an opportunity for people to indicate if they were interested in being on a standby list. So I wanted, both for that reason, also to identify people who may be homebound, so that we can use our community paramedicine program to go out to them to administer vaccine, and also just to have an active notification process for people, because we didn't know what risk groups are going to be next, and we still really don't. We know the ages, the state has released that since we released our survey, but we don't know beyond that. So just trying to find a way to bring all this information together to actively notify people who want to be notified as this process goes on. For that reason, we created a vaccine interest survey. That's the registry that Josh mentioned. It's really, like, I call it a survey because because really we're just trying to collect this information to actively notify people, to produce that standby list, to produce that homebound list, and that kind of thing. It received way more interest than I even thought possible. We have over 17,000 people on that list already, so it's gotten a lot of interest. It's been great. We're using it to call down our standby list. We've been able to get quite a number of people in there. Some of the people on our standby list already had appointments. It was great. We kept calling down the list, so, and then we're also using it actively right this very minute, because we're finding out that since our appointments are filling up so fast, since we're getting through these vaccines, and since we have this efficient process, the state is giving us more vaccine. And so we're adding people in right now from that standby list to come in tomorrow. So all of these things are, just part of that plan to be able to ramp up as needed and as we have vaccine. We are dependent on the state for some of this, but it is working really, really well from that point of view. The other part of it is we know that over time the supply is going to increase. The vaccine components. We'll have other vaccines we're dealing with. We need a larger site. So for moving up from here, right now we're administering vaccine at our site that we're also using for the schools testing facility. The one there on Technology Drive, but going forward, we know we're going to need a bigger location. We hope to be able to administer 1,000 doses a day or potentially more, depending on what we have access to. We just want to be ready and to facilitate, like I said before, getting as many doses into as many arms as possible, as fast as possible.
Great. With that, open it up for the board to have any questions for Monica, Dr. Lane, or Josh.
Yeah, this is Kyle. I'm actually curious. So on the standby list of the 17,000 for the last doses, how are we managing the follow-on dose, the second dose? So it kind of puts them in that queue with the folks that received it. How are you managing the second dose and making sure that they're able to return within a reasonable window for their second dose?
So it actually, once they're on the list, and once they come to the site and they're registered, then they follow the same process as anyone else. So once we've called them in, we get them in the system, they're registered, they go through the same process, and just like with everybody else, at the end of their appointment, when they're in that 15-minute waiting period, that's when we schedule their second appointment. So there's no problem from that point of view. As far as allocation of doses, then that's something that gets managed with those appointments as the state ramps up the vaccine production.
Excellent, thank you.
Any other questions before we consider adjournment? Well, I personally want to thank Monica and her team from the Public Health Department. It is extraordinary what's being undertaken right now, and they're doing a great job. I also want to put a plug in for a whole bunch of other departments within our organization that have really stepped up to help facilitate a lot of the logistical work that's getting this done, from IT to building maintenance to our business solutions group. I mean, everybody's just rallied to help, and it's an exciting time to see kind of this forward progress. And I'm quite certain in the next 30 days, when we have our next update, there'll be a lot more to share. So with that, if there are no other questions for anyone, I do want to take a moment. Dr. Lane, is there anything that you would like to share with the board prior to adjournment?
Just great teamwork. Monica has been a phenomenal leader, and it's amazing to see the amount of work that has happened in a very short period of time. And, it's nice to have one of these meetings and feel optimistic. And I think it's been a long time coming. So just wanted to say thank you to Monica, Josh, Chief, obviously the mayor, and all the other people that you guys mentioned, because seeing it from the public health standpoint compared to what I see at the hospital, it's quite impressive.
Thank you, Doctor. Yeah, one other quick item I forgot to mention. We are in a legislative session right now, and I was talking to Chris Kreisel, city attorney, this morning, and he has done a pretty thorough review. And as we expected, there's a lot of legislation in regard to public health. So Chris was going to provide the board just a quick synopsis so that everyone kind of understands what's being considered, frankly, down at the legislature right now. So I'm going to turn over to Chris for a brief update on that prior to adjournment. Chris?
Thanks, Mayor. Good afternoon, Board. As the Mayor mentioned, we, with legislative session going, we've been closely monitoring a lot of bills. And for those of you who pay attention to anything going down at the State House, you know that COVID, the health department, the governor's authority with respect to COVID are under a lot of scrutiny right now. I'll tell you, just in general, there are 17 bills by my count that have been filed that either affect the governor's authority under these emergency declaration periods or the local health department's authority. So we are going to be closely monitoring those and providing updates and intervening and getting in those conversations as we see fit. I'll tell you all the bills, even though each one of them are separate and distinct, they all kind of carry the same general theme. One of them is a restriction on the governor's authority with respect to declaring an emergency disaster. So you may be aware that on March 6th of 2020, the governor issued his first declaration of an emergency disaster through an executive order. And since that time, he has subsequently been extending that authority through separate 30-day extensions of that executive order. So there are some people down at the General Assembly who don't think that extension in perpetuity is the right thing. Most are calling for the General Assembly to weigh in on that in some manner, whether that's after a 30-day order, whether that's within a quicker time period. But I think you can see that in some form or fashion, the General Assembly is going to insert itself into those emergency disaster declarations as we go forward. The other major topic is with respect to the orders that are issued by local health departments in response to the governor's emergency declaration. So some of the things that we've done with respect to mask mandates, business regulations, restaurant regulations, et cetera, the things that we feel are in the best interest of our community based on the powers that are afforded to us as a health department right now are also being considered and scrutinized. A lot of these bills range from having another level of review, whether that's from an approval by the mayor, whether that's through an approval or an appeal process through our city council, and or whether there's a limitation on those powers altogether during times of emergency, are kind of being all vetted out. So we are monitoring those. I'm always happy to answer any questions either now or offline, and always happy to send you those bills as well directly if you want to have some deep reading over the weekend. So it's a popular topic. It's going to continue to be moving through the General Assembly, and we'll continue to pay attention.
Thank you, Chris. I'm likely to have more updates as we get through the legislative process. I would assume that the next board meeting probably have more refined information as some bills move forward and others do not. With that, seeing no other agenda items, is there a motion to adjourn the meeting?
Sal Migliore, adjourn. Motion.
Motion, is there a second?
Second.
This is Kyle.
Great, we have a second. All those in favor, please say aye. Aye.
Aye.
Aye.
Great, thank you, everyone. Have a great weekend, and great job, Public Health Department. We'll talk to you soon.